Hi, this is Dr. Neuhaus. I want to talk to you about peripheral arterial disease, also known as PAD. It's a very common circulation problem that people will get in their legs. PAD can affect anybody. What it is it's disease of the arteries. Arteries take blood from your heart to your feet. Veins take blood from the feet up to the heart. So with PAD, people have a blockage, just like you've heard people having cardiac surgery. They have open heart surgery to have bypass surgery. What they're doing is they're bypassing a blocked artery. The same type of thing can occur in the legs, in the arteries, where the blood just doesn't flow well to the foot for some reason. People who need a test to look for this are people who have diabetes, people who are smokers, people who have pain with walking. I'll see this often in my office where somebody comes in and says, my legs just get tired, my calves cramp, I can't walk through the grocery store, or I can't walk around the block. And that's one of the key questions is how far can you walk before you get cramping in your calves? If you can't walk very far, you get cramping within a couple minutes of walking or running, you definitely need a test for PAD. You may have some narrowing of the blood vessels or a blockage of a blood vessel in your leg. Rest pain. People who sit down and get cramping in their feet, not necessarily cramping in the calves in this case, but at night if you wake up because your feet are cramped up, the only thing that'll make it feel better is getting out of bed and walking around. That's an indication that you may have some circulation problems. So a test that we can do in the office for PAD is what we call a PADNET exam. What that is where we put blood pressure cuffs around your thigh, your calf, your ankle, and your toe, and compare that to the blood pressure in your arms. And we hook it up to a computer, it measures the pressures, it evaluates the blood flow. So with that, we can determine if there is a blockage, if the blood flow is normal, if there's any issues that we need to look at further. There are specialists who, just like there's a heart specialist that will do bypass surgery for your heart, there's specialist vascular surgeons that will do procedures on legs to help with the circulation. Sometimes this can be managed with medication. Sometimes it's just exercise. Believe it or not, if you have PAD and you get out and exercise and fight through that cramping, your body can build new blood vessels and strengthen itself and increase that blood flow to the area. So even though it hurts, if you fight through it, that can be beneficial for you and can be a way to treat it. So PAD is something that is not to be taken lightly. It's one of those things that people may have and not even realize, which is why we recommend a simple test to evaluate it. We can do it in the office. I have a little questionnaire that we fill out. Basically, it asks you the questions that I just talked about. Do you have pain with walking? Do you have pain at rest? Are you a smoker? Do you have a history of heart disease in your family? History of PAD? Do you have diabetes? Depending on your age. It's a simple questionnaire that you go through, and basically if you circle yes to any of those things, you need a test for PAD. So if that occurs, talk to your doctor. Come see us in the office. We'd be happy to take care of that for you.